busy working on 2 different lectures for this class when it occurred to me that a lot of people had no idea that some of the most significant changes to access to their healthcare records went into effect recently. On October 6, 2022, new federal rules went into place that are designed specifically to give you and your loved ones electronic access to virtually all of your health record information. Welcome to Healthcare 101. I'm Professor Sean. This week we're going to be covering some of the more significant healthcare regulations which have been designed to help engage consumers and improve access to your data. After all, it belongs to you. Healthcare has long been regulated by federal, state, and local governments. These regulations or rules are administered by a wide variety of institutions, including the United States Congress, the President of the United States, the Department of Health and Human Services, the Food and Drug Administration, state legislatures, governors, local departments of health, and many, many more. While there have been numerous laws and regulations that have impacted healthcare, some of the more impactful ones include the 1965 Medicare and Medicaid Act, the 1996 Health Insurance Portability and Accountability Act, HIPAA, 2005, the Patient Safety and Quality Improvement Act, 2009, Health Information Technology for Economic and Clinical Health, or the HITECH Act. In 2010, we had the Affordable Care Act, better known as Obamacare. In 2015, we had the Medicare Access and Chip Reauthorization Act, otherwise known as MACRA. And then in 2016, we had the 21st Century Cures Act. This was designed to help accelerate medical product development and bring new innovations and advances to patients who need them faster and more efficiently. So while all of these have significant impact, I'm going to take time just to go over 3 of these. The 1996 Health Insurance Portability and Accountability Act was designed to develop national standards to help protect your health data, especially any information of yours that is being transmitted, say from your healthcare provider to the insurance company, from the insurance company to who knows where. It also required that the healthcare industry as a whole work to review and develop new standards on how to engage with their vendors, with employees, as well as with patients. One area in particular focused on ensuring that patients had the right to access their healthcare information. You may not be aware, but ever since 1996, you have the right to go to any of your healthcare providers and ask for a copy of your medical records, and they're obligated by law to deliver them to you in the format and the fashion you are asking for. The 2009 HITECH Act was built as an economic stimulus program at the height of the Great Recession. The primary goal of this legislation was to use incentives to help hospitals and providers adopt electronic health records. This particular program was called Meaningful Use, and it provided a set of goals, or they were known as measures, which, if met, providers and hospitals received generous incentives. The goal was to incentivize participation and to penalize complacency. It worked. As you can see by the graph here, that the adoption from EHRs went from the around 30% in the early 2000s to over 87% as of 2016. Now that utilization has grown slightly since then, but it has pretty much leveled off. While I could talk about the HITECH Act for hours, I'm not going to, but I do want to add that this program included measures where, to get the incentives, providers had to engage patients through the use of patient portals. This included the ability to message your providers with questions about your care, and the ability for patients to review their test results or after visit instructions. It was the beginning of connecting patients and providers electronically. One of the main goals of Meaningful Use was to establish a set of requirements and standards which allowed provider organizations to share their information electronically. This was called interoperability. This would help ensure that providers taking care of a patient in one part of the country could immediately get access to that patient's information that existed in another part of the country. While we've seen some improvements in interoperability, some pretty big improvements, it really hasn't lived up to the hype and the promise that was designed. And that's what the 21st Century Cures Act was signed into law in 2016 by President Obama, and like most congressional acts, it contains a lot. Some of the changes promoted the usability of low-risk apps and devices. There was some really significant mental health reform. Interoperability was also improved, and much more. Pointedly, the Cures Act aimed to fix some of the shortcomings in patient engagement and interoperability that were left out by the HITECH Act. While there are a lot of fancy terms in the law, the main thing I wanted to communicate is that this law is designed to put you, the healthcare consumer, the taxpayer, in the driver's seat, in charge of your own information. Meeting for Use had rules which required the electronic sharing of information, but this was easier said than done. Some of the blame fell on vendors due to struggles to create and adopt new standards to share data with each other. Sometimes there was anti-competitive nature, other times it was just the sheer complexity of the work itself. Part of the blame had to do with the regulation and the lack of guidance, direction, and there weren't significant penalties for failing to develop the interoperability standards that were promised. One of the main benefits of the 21st Century Cures Act was the requirement that providers allow you to have free access to virtually all of your electronic health information. Now, the Cures Act, there were many different phases of this rule, but the final phase did go into effect on October 6th. Some of the key improvements that happened over the past couple years. As of now, in your patient portal, virtually all of the provider notes from anyone you have seen should be available to you to read in full in your patient portal. In addition, test results are now required to be shared with you virtually at the same time that your provider were to receive them. Now, in the state of California, there are some rules and regulations that require vendors and hospitals to take into consideration that the providers should have some opportunity to see that before the patient does. But for the most part, your results are ready in near real time. One of the other features of the 21st Century Cures Act was a requirement that if you as a consumer are using an app to monitor and manage your health, and let's say that that app has developed the ability to pull in information from an electronic health record with those new national standards I mentioned, it is a requirement that your provider and the vendor who develops that electronic health record, that they work with you and that app to get your information in the way that will be usable by you too. So in your Weight Watchers app, let's say that they develop the ability to look at your blood chemistries or your weight over time or your blood pressure from your healthcare provider. They're required to figure out some way to display that information for you in the application, that you should be able to take the risk on what information you want to use from your record in whatever manner you want. So when thinking about HIPAA, back in 1996, that rule did allow you to request copies of your healthcare data, and that could be paper or digital. The Cures Act improves this by requiring that you have the ability to request a full copy of all your electronic health data for free, electronically. Now, one of the bigger caveats of that is the format with which they have been designed to provide these exports, they're really not intended for you, the consumer, to open up and review them. They're considered machine-readable files. Therefore, when you do or receive a copy of your electronic health information, it'll be in a format that most likely you would struggle to actually open up and review. However, the design of this is for applications, websites, other EHR vendors to have the ability for you to take that information, upload it, so you could receive and view a full copy of your chart in the way that you want to. It puts you in the driver's seat of that. Now, I do want to call out that it's important to realize that when you contain all of that private health information on a thumb drive, on your hard drive, just take care to make certain that you have the security in place to protect your data. Just like the HIPAA rules in 1996 required us as providers and healthcare organizations to protect your information, the government's giving you the ability to do that same protection. However, it is strongly encouraged that you do everything you can do to protect your data. As you can see, I feel that the regulators are doing a good job of continuing to push providers to engage patients and ensure that the management of healthcare information is protected and modernized. Healthcare providers do a good job at adapting most of these regulations despite their complexity and technical challenges. The issue remains that consumers, patients, and taxpayers are often not aware that these rights exist. I encourage you to take the time to work with your healthcare providers to see how they are adopting these regulations and how you can participate more fully in managing your care and your health data. I'm Professor Sean. Thank you for watching. If you enjoyed today's lecture, please subscribe below, and I look forward to any feedback that you may have. Until next time, stay healthy and informed.